Hello and good afternoon, guys. Welcome to Wellness Week 109. My name is Dr. Philip Ross, and I'm one of the chiropractic physicians here at the World of Wellness. A little bit of background about me before we get started. So I'm a chiropractor, and I also went for a master's in sports rehabilitation. And then just 2 years ago, I actually sat for another certification that I received. It's called a CCSP, so I'm a certified chiropractic sports physician. Basically what that means is, yes, we do adjustments in the room, but I'm huge on rehab and exercises and corrective exercises. So I kind of take some of the principles that I use with most of my athletes and just give them to everyday people. Because if you're in the garden, if you're picking up a case of water out of your vehicle, those are all relatively athletic movements. So basically I just like to coach people how to do everything properly so you're not having any kind of injury. So today we are going to be talking about stability versus mobility. And since I'm a big golf guy, I think we're just going to stick with the low back and the hips today. So we're going to talk about how to stabilize your low back, and we're going to show you a couple different hip openers, so to speak, so you could have better range of motion in your hips, and you won't have to go through that extra range of motion through your lumbar spine, leading to potential injury. So before we start with any kind of exercises and talking about core stability, we are actually going to start with something called DNS. If anybody's ever heard of DNS, it stands for Dynamic Neuromuscular Stabilization, and that actually goes back to fetal development. So if you look at an infant, usually when you're watching an infant, they breathe through their abdomen, they breathe through their diaphragm, and it's not until you get tired, bad posture, and then everybody starts to kind of chest breathe. And the reason why we start with DNS is, to make a long story short, one of my mentors and one of my teachers at Logan University, where I went to school, Dr. Winchester, he works with all the St. Louis Cardinals, specifically the pitchers. And before he even starts going over the biomechanics of their pitching motion, assessing their shoulder, assessing everything in the motion to pitch a baseball, he will start with intra-abdominal pressure, which is that diaphragmatic breathing. Because if you have good intra-abdominal pressure, it's going to basically link your upper extremity to your lower extremity, just so you're not getting any kind of injury, and you could even create more power. So I can't stress that enough, because a lot of people, a very, very common symptom, people come in, they're like, well, I hurt my back, basically just picking something up off the ground. And usually if you have good biomechanics, when you go down to pick something up, and especially keeping the intra-abdominal pressure, you are way less likely to actually have any kind of injury. And so a good analogy for the intra-abdominal pressure, the diaphragmatic breathing, is think of a can of Coke. If you have a can of soda or pop, whatever you want to call it, it's very, very hard to compress that if you have pressure in it, as opposed to if you have no liquid in the can. It's very, very easy to compress. So if you don't have good intra-abdominal pressure, you're actually compromising your lumbar spine, and it's going to lead to an injury. So most times, if I have a patient with any kind of low back pain, any kind of lumbar disc herniation, lumbar disc bulge, or a pinched nerve in their back, before I show them any kind of exercises or stretches that they could do at home, we'll basically run through the DNS, the diaphragmatic breathing. So you guys could even do that sitting at home. So the biggest thing is when you try and teach this, everybody thinks they just want to breathe out through the one plane of motion, kind of forward, but you actually want to think of that canister principle, right? So you're trying to breathe through all basically planes of your abdominal, basically your core, and that's really going to support your lumbar spine and not lead to an injury. So usually when I have patients do, and I'm going to get Phil moving and grooving because he's been sitting the past 2 days, and when we go over our dead bug exercise, I'll kind of explain, and you'll see me just do very, very small cues to kind of keep the pressure in his abdomen, so it's truly working his core stability muscles, and it's not leading to any kind of instability of his low back. So getting back to it, one of the best things you could do for any kind of low back pain, yin with the yang. If you have weak muscles in your low back and your back kind of gets injured every couple months, you really want to stress the core stability muscles, just because the stronger the core is, the more it's going to support your back, and the less likely you are to have any kind of injury doing anything you're doing in life. So I guess we could kind of jump right into it, and we'll start with the core stability exercises. So I'm going to grab my man Phil here. And Phil, you are going to be on your back here for me. And you could go head right here and then feet here. Okay, so this is probably my favorite one. This is called a dead bug. Doing this properly, you're going to feel a really, really good burn in your core. And I guess we should start with it. A lot of people think core stability, and they do like Romanian twists. They do like the hanging windshield wipers, all these kind of crazy sit-ups. Your core stability muscles are actually stabilization muscles of your spine. So you actually want to train core stability muscles with your spine in a neutral position. That's a huge mistake a lot of people make. So basically the four we're going to run through, it's all training your core with a stable spine. So at first we're going to do the dead bug. And so at first I'm just going to cue Phil. I'm going to sneak behind here. And so the dead bug, it looks how it sounds. So what we're going to do is you're going to bring your knees up into a 90-90. And then arms are going to be straight up in the air. And the biggest take home, if you're doing this at home, a lot of people when they set up, you could kind of put your hand under their low back. You want your low back flat on the surface that you're on. That's an absolute vital cue that you have to have. So usually the way I instruct patients is I think of taking your belt buckle towards the sky so your back will kind of stay flat on the ground. And then next, I'm going to cue the patient to basically start to keep the intra-abdominal pressure from diaphragmatic breathing. So you're basically just going to take a breath in through your belly here, and you're going to let it out. And so what we're looking for is the chest to stay quiet, and he's actually just breathing through his belly. And that's actually really good right there. Because again, the more pressure you have in your abdomen, the less likely you're going to have any kind of injury to your lumbar spine. So we'll start from the ground up and we'll work till it's a little bit more difficult. So at first, we're just going to drop one leg. So Phil really slow is going to take a heel down, touch the table, and then come back up. And then he's going to go opposite leg. And the slower you go, the more demand it puts on your core. Let me know if you start to get tired. and so that is a good start. And I would say if you're going to do these at home, anywhere from 12 to 15 repetitions is going to be a great start. And then so that's the easiest one that you could start with, and then opposites get big. So what's going to happen is Phil is going to go right leg down, left leg back. And then again, the slower you go, the more it's going to engage your core, the harder it's going to be. And the biggest cues is you want to keep the pressure in your abdomen, and you want to try and keep your back as flat as it can on the ground. And so that's actually pretty good. Yeah, so that is a dead bug, so you can relax here. So I would recommend patients, if you're going to do those, maybe for the first 3 or 4 days, just start with your legs before you kind of get your upper extremity involved. And once you feel comfortable with those, then we're going to kind of turn it up a notch, and this is the hardest one to do. And so what I'm going to do for Phil is I'm going to give him this ball, and he's going to compress it between his arms and his knees here. And then when he goes to do his right arm and left leg, he's going to compress down and keep the compressive force. So that's just going to absolutely fire his core like crazy. Is that a lot harder?
I mean, it feels a lot better.
Yeah. So this is probably the greatest way to engage everything in his all his core stabilization muscles. So this is probably my favorite core stability exercise. It's super, super simple to do. And if you do it the right way and you don't need to go to the gym and have all these kind of different machines, you could just get a really good workout with the dead bug here. And buy an exercise ball. Okay, and then the next one we're going to go to, it's kind of the inverse of a dead bug. It's called a bird dog. So Phil, you're going to go on your hands and knees here. So we're going to flip over. So again, yin with the yang, we just worked everything basically on the front, the anterior side, and now we're going to work the posterior chain. So again, it's absolutely vital that you keep your intra-abdominal pressure so you support your lumbar spine so you don't have an injury. So he's going to be on hands and knees, and then this up on your hands. Yep, and then same thing, just the opposite. So we're going to go right arm gets big and left leg gets long too. Same thing, but opposites, yep. And then again, the slower, the better. A lot of patients, they were like, oh, I was doing that, it was pretty easy. I was doing like 25 repetitions. They were probably flying through it. A big clinical pearl is the slower you do it and the more controlled you do it, the most bang for your buck you're gonna get. So if you can only go slow and do like 8 to 10 repetitions, that's totally fine. You don't have to go crazy and try and crank out like 30 repetitions. Okay, and then the last two we were talking about, everybody probably knows what a front plank and a side plank is. You know how to do plank? Yep. And then the biggest thing is too, so like this is where you really need to hold the intra-abdominal pressure. So while Phil's holding this, it's vital that he tries to breathe through all the quadrants of his abdomen, just so the low back's supported. You fatiguing a little bit? Okay. And then for the side plank, you could lay on your side here for me. And I usually like to instruct patients, instead of going right off of your ankles at first, sometimes you could just do a side plank off your knees. That's a little bit easier before, and then you're just gonna hold, and the same thing, he wants to brace and breathe through his whole abdominal cavity. And if he feels good off his knees, then he could kind of even pick it up a little bit more and go off his ankles. Yeah, and those are those are the staples. So like if you go to any physical therapist and you have any kind of lumbar pain, they're gonna give you the core stability exercises. So you could relax here. And then the last one that I really, really like, it's kind of like an anti-rotation movement. Phil, do you mind standing up here for me? This is called a Pallof press, and I actually give a lot of golfers this one just because it's an anti-rotational stability exercise. So I'm gonna be the doorknob and Phil is gonna be exercising, so you could face the camera. And then a Pallof press, super, super simple. You get actually a lot of strength out of this. There's something called a multifidi muscle. It's basically a stability muscle of your lumbar spine, and this really, really works this. So when you do this, you wanna make sure that you have a decent amount of tension. And Phil, you're gonna hold the band just like this, right in front of you, and I'm gonna put a decent amount of tension. And I usually instruct the patient to have feet kind of stacked under your shoulders, and you're gonna take a deep breath in through your belly, and then he's basically just gonna press the band out towards the camera, and then slowly back in. And I know this looks super, super simple, but if he would do 12 repetitions with this, you would feel a massive burn on the right side of your lumbar erector and multifidi muscle. And again, this is just a really, really good stabilization exercise. And most of the times, people with any kind of low back pain or a disc bulge or a disc herniation, we have to strengthen your core so it will support your lumbar spine. You okay there? You feel any burn? Yeah. Yeah, so usually I'll give patients like 4 core stability take-home exercises, and then we'll kind of go into the hip mobility because, again, yin with the yang. If you don't have good hip mobility, it's going to basically compromise your low back, and you're going to be trying to use your low back for extra degrees of range of motion, and we don't want that because that's when it leads to an injury. So the most common way that you could injure a lumbar disc is actually in flexion and rotation. So that's why a lot of people, when they come in, they're like, yeah, I tweaked my back picking a pencil up off of the floor. You don't keep intra-abdominal pressure, and you just bend over in flexion and you rotate. And that's when someone says they slip the disc or pop the disc, that's your disc herniation, so to speak. So we want to try and limit the flexion and the rotational movements at first, just so the disc get healed. Long story short, you have 22 to 24 layers of, they're called lamellar rings, and they basically hold the jelly inside the jelly donut in your lumbar spine. And they're avascular, so you don't really have a good blood supply. So you could actually have micro tears of a disc and not even know it. And you could go get an MRI and it would say that you have a disc bulge or a disc herniation. Me personally, I'm not a fan of sending someone for imaging right away because you could feel 100% normal and feel great and go get an MRI and they could say you have stenosis or a disc bulge, and then it kind of just instills fear into the patient. And I don't like to do that because if you did anything physical in your life, realistically, if you're over the age of 50 or 55, you're going to have some degree of stenosis or potential loss of disc height in your discs in your lumbar spine. And at the end of this topic, we're going to basically go into supplemental support for that as well. So for the hip mobility exercises, do you want to do them or do you want me to do them? Okay, so for the hip, we're going to talk about external rotation of the hip. So external rotation of the hip is going to be, if you're sitting down, if you're watching this at home, external rotation is basically taking your foot in, and then internal rotation is taking your foot out. And this is absolutely massive in the golf swing, especially going through your backswing off the tee box. And so we're going to give you a couple stretches for the external rotators of your glute, just so you have better range of motion in your hips so you're not compromising your low back here. So the first thing we're going to go over is the figure 4. So you could lay on your back here for me. And then this is probably the most simple one that you could do. And what Phil's going to do is he's going to put this foot flat so you could kind of put your heel towards your butt right here. And then you're going to take opposite leg and you're going to put it over your right knee. And so at first, usually I'll just get a gauge with the patient. So I'll have them, you could basically just kind of press yourself into that leg. And some people don't even feel the stretch there. So then we kind of go by picking this leg up. So you're going to take your hands, grab the back of your hamstring here, and then you're going to pull that leg towards your chest. And that is the figure 4 stretch. This is one of my favorite ones to kind of loosen up the backside of your hip. Do you feel that in your glute over here? Yeah, and that's a very, very simple one you could do. I instruct a... Yeah, whatever's the most comfortable. Yeah, the main thing is basically getting that knee close to the backside of your left shoulder here. So I usually instruct people if they have any kind of pain or tightness in their hips or their low back, even just to kind of do this before you get out of bed. And I would suggest when you hold this for anywhere from like 30 to 45 seconds. If anybody played any sports back in the day, when you go to stretch your hamstrings, it's like a 10-second count. Realistically, that doesn't do a thing. Just to kind of reset the muscle spindle, you have to do it for like at least 30 to 45 seconds. And then next we're going to do a 90-90 sit. So I'm going to have Phil, you're basically going to be seated like this. So one leg in front and then one leg in back. And this is actually one of the ones I do personally before I go golf, just to kind of open my hips up. This is a very, very powerful stretching exercise. So what Phil's going to do is, and I guess I should preface it with this, if you can't get in this position, like a little cheat to make sure you're doing it properly, the closer the front leg's heel is into your opposite groin, the easier it's going to be. So if he scooted his heel a little bit closer, it's almost kind of like a modified pigeon. It's going to be easier at first. So if you have trouble even getting in the 90-90 sit, I would recommend taking your heel towards the opposite groin. But since Phil was actually pretty good at 90-90, we're going to go 90-90. Yep. And so now next what Phil's going to do is, I like to say kind of go around the world with it. So what he's going to do, he's going to try and stay tall, and then he's basically going to take his chest towards this knee. And then when I say go around the world with it, I'll basically have patients kind of like oscillate and go, yeah, so like I'll basically have them like start here, and then I'll have them go to the outside, and then I'll have them go to the inside. And the reason I have them kind of just do that is because the difference, how like when he changes basically the line of his thorax, you're going to feel it in different parts of the muscle. And this is a stretch for something called your piriformis muscle, and it's also a stretch for your glute med. And then the rehab for this, so if you want to stretch it, you want to strengthen it as well. So the rehab for this it's kind of just like a get up. So Phil's going to basically stand, you're basically just going to try and get up on this leg here. So it's going to look like, so you're going to go seated, and then you're just going to get up on this leg and then slowly lower. Yeah, so you're going to try and like take your butt up here. There you go. Yep, and then you're going to slowly lower back down. So, and usually when I have people do this and you can slowly lower, sit back down, I'm going to tweak your leg here a little bit. Perfect. And then you're going to do a get up here again. Yeah, sorry. Tough table for it. Yep. And then you're going to slowly lower. And then so if you're going to stretch everything in your piriformis muscle, you want to load it as well. So that is a really, really good way to kind of load that. And then you could pop up here. And then lastly too, some people, it's kind of hard for them to get on the ground, whether it is from, like a bad knee. So you could even do like standing. So you could basically go on your coffee table, and this is just another way to do a modified figure four. So you could put your foot up, and then same thing, you're gonna lean forward. And then when I say like kind of oscillate into it, I'll basically have patients just like slowly wiggle, and then you're gonna hit all different sides just because you're hitting different parts of that muscle. And so the reason why I kind of like do like small circles is you kind of get into like the nooks and crannies, so to speak. So you kind of get that full range of motion. And then lastly, we're going to go over something called the iliopsoas. That was absolutely huge this year. A lot of people were talking about the psoas muscle. So your psoas muscle, it actually attaches to the bones in your low back and then goes through the front part of your body and attaches to the front of your hip. A lot of people are having trouble with that. And a lot of people think that it's just like crazy tight. Yes, it is tight because all we do is sit, right? So when you sit, you're basically shortening that psoas muscle. And if you shorten that psoas muscle, it's going to lead to low back pain because it attaches to the vertebra in your low back. So when that psoas muscle gets tight, you get something called an anterior pelvic tilt. So your pelvis kind of wants to roll forward, and then it really stresses the joints in your low back there. So for the psoas, if we are going to stretch it, you want to strengthen it as well, because 10 times out of 10, if it's tight, you need to strengthen it too. So one of my favorite ways to kind of work on the psoas muscle is, it's basically called a psoas march. So I'm going to get this band here for you, Phil, and you are going to stand up here for me, and then you're going to put this on your feet, on your shoes there. Just right on your feet, right there. Yep. Yep. And then, so for the psoas march, so the iliopsoas, again, attaches to the bones in your back, goes through the front of your body to the front of your hip. So one of the best and easiest ways you could strengthen this is, you could buy these TheraBands on Amazon. They're like $15. And what he's going to do is, you're basically just going to do a psoas march. So he is going to rapidly fire his knee up, hold for a second, and then slowly lower for 4 seconds. Yeah. Sorry, that's a heavy band too.
I just didn't know what to expect.
Yeah, so that is one of my favorite ways to kind of strengthen your psoas muscle. Again, it's always tight on people, especially if you're in a seated position all the time. And ideally, if Phil had a wall in front of him, I guess I could be your wall, just so he could kind of balance. Yep, and you fire up. 100%, yeah. So you fire up, hold for a second, then slowly lower for 4, and that is called an eccentric range of motion, and that is going to be the best way to recruit all the muscle fibers to strengthen that muscle. All right, you're good there. Yeah. Yeah, so, and then the other way I like to kind of work on the psoas too, I usually will have patients like first sitting on the ground, and I'll usually get them to get like small water bottles, or you could even just use supplement containers, and I'll basically have them sit with their back supported against the wall in straight leg. And basically what you're doing is, think of arms on a clock. So you're trying to take your leg up and over each arm on the clock here, and then go as far as you can and then come back, just because that's going to help to strengthen the iliopsoas and some of your hip flexor muscles. And then lastly, for the stretch of it, I'll show the stretch. Yeah, so for the stretch of the iliopsoas, this is all over the internet, and basically when people do the iliopsoas stretch, if you go on YouTube, Instagram, they'll basically just have patients get like this, and then you're just moving your hips forward. That's all right, but if you make a couple small tweaks, you could really get the most out of it. So a lot of people, when they set this up, I say they have the Beyonce butt, their butt's kind of pushed out. So if you just do a simple tweak and you go from your Beyonce butt to stacking your pelvis under your rib cage, you're gonna feel that light up as soon as you do that. So I would say you could kind of do anterior pelvic tilt, and then you're going to go to a posterior pelvic tilt. So basically taking your belt towards the wall right in front of you, and then you're going to lean forward. And that's going to be the best way to kind of hit that psoas. And then if that's still not enough, if you're relatively flexible, so you're going to go pelvis stacked on your rib cage, you're going to lean forward, and then you could go arm up and lean away from it, and then you're going to feel a huge stretch through there. And that's probably my favorite stretch for the iliopsoas. But again, I can't stress this enough. If you are feeling any kind of discomfort in that muscle, if you stretch it, you have to strengthen it. So if you're going to do those stretches, buy the TheraBands at home, so you could do some of the psoas marches. And then if you don't have access to getting those bands, then you could just sit on the ground. Again, put water bottles on like arms of the clock, and you're basically just going to sit as erect as you can, leg up and over the water bottles, just to kind of strengthen that muscle. And then for the supplements, we were talking about stability versus mobility. So almost everything in life, you want a stable lumbar spine and you want mobile hips. Just because if you have a lack of mobility in your hips, it's basically going to force your lumbar spine to go through motions that it's not wanting to do, and that's usually when people have an injury. So the supplements that I like to recommend for a stable spine. So I would say the gold standards are HA Plus by Nutritional Frontiers, just because if you look at the research, the 4 things that help for joint support is hyaluronic acid, glucosamine, MSM, and chondroitin. And I had a question for Jamie as soon as I started here. I was like, well, you have 3 of the 4. Where's the chondroitin? He was like, well, we use BioCell 2 collagen, which basically yields chondroitin. So even though it doesn't say it on the bottle, you're still getting the 4 big things kind of for your joint support. And then I guess we could relate this to for women with osteopenia or osteoporosis. Can't make this up. I had a woman come in and she got her DEXA scan, and she had osteopenia, and then 2 years later she got her DEXA, and she actually had osteoporosis. And I got her on the Super Cal Plus, and then I got her on our Super K2 Plus. And the cool thing about the Super K2 Plus that a lot of people don't know, if you research now, it always says if you're going to take vitamin D3, you want to take K2 with it. And the most absorbable form of K2 is something called MK7. Why do you want to take that? Think of it as like a quarterback of the system. So the K2 is basically going to pull the calcium out of your blood and deposit it to where you need it to go. And what's super cool about Nutritional Frontiers Super K2 Plus is it also has vitamin A in there. And vitamin A is going to get rid of the brittle bone. So when you build new bone, you're actually going to put down like strong bone, and you're not just kind of going over like lighter bone. And then also have to be on the calcium as well. And I also recommended for this patient to start strength training. There's a place called OsteoStrong. It's in Green Tree. And so she started going there twice a week for exercises. And then I also recommended she got a 15-pound weighted vest because she liked to walk 5 times a week. So she would wear her weighted vest when she was walking. She went to OsteoStrong. She got on those 2 supplements. And 2 years later, can't make this up, she went from osteoporosis back down to osteopenia. So her T and her Z score actually got better. So it's not a death sentence if you have that condition. You just got to be on the right supplementation, and then you definitely got to exercise as well. There's only 2 pros to being obese. That is insulation and bone density. Because the bigger you are and the more mass you have, your brain's like, hey, we need stronger bones to kind of support our structure here. So that's why I recommend anybody with osteopenia or osteoporosis to get a weighted vest. You don't even have to go 15 pounds. You could go 8 to 10 pounds. And if you're going to go for a 20-minute walk every day, throw that on. And yes, it's going to be hard at first, but that will seriously make a huge difference, especially for the neck of your hips and your pelvis too. And then what I also like for soft tissue, we're talking about mobility. So if you've ever like had tweaks of like lateral epicondylitis, like tennis elbow, or if you tweak a hamstring a lot, or if you just kind of have like bad connective tissue in your joints, so like tendons and ligaments, 2 products that I really like. I like something called Ligaplex 1 and 2, and that is a product by Standard Process. The cool thing about Ligaplex 1 and 2 is it's high in manganese, which is actually going to kind of strengthen your tendons. So Ligaplex 1 is for more of an acute setting, and Ligaplex 2 is going to be more for like a chronic condition. So like if I have any athletes, so I treat a couple college wrestlers, and they are always tweaking something musculoskeletal wise. And usually what I'll have them do is I'll have them take a full bottle of Ligaplex 1 if they had any kind of like injury. And then once they're done with that bottle, I'll get them on a maintenance dose of Ligaplex 2. And that is going to be the best things that you could basically take to strengthen and have better integrity of muscles, tendons, and ligaments. And then I guess we could kind of talk about some of the services we have too that could kind of help with some of this stuff too. So also what we have in the back there, it's actually a really good week, and I think we might be doing some free testing next week as well. I like to put a lot of the athletes and anybody that's just active on some of our modalities back there too. So we have something called Normatec compression boots that were kind of hot this week so far. And long story short, what Normatec compression boots is, a lot of people ask, well, hey, I have compression socks. Can I wear those for any kind of edema sitting in my legs? You can, but it works with pneumatic compression. So there's 2 types of people in the world. There's someone that gets towards the end of their toothpaste roll and they'll just throw it away. And then there's those people that will kind of like inch every little bit of toothpaste out. That's kind of what the Normatec compression boots do. They're basically big leg sleeves. They start with your feet and they go all the way up to your hips, and it's pneumatic compression. So it will basically compress on your foot, to your calf, to behind your knee, to your thighs, and then all the blood, all the lactic acid and metabolic waste kind of gets flushed out, goes through your vital organs, and it gets highly oxygenated and nutrient dense. And so when the blood goes back down in your legs, that's like when you have all the good healing factors. So just about like a month ago, it was like basically training week for like football and soccer and all the high school sports. And a lot of kids coming in just because they have their heavy legs, so to speak. And we usually put them on after practice just because it will flush all the lactic acid out so you don't have the heavy legs. And I guess going back into that too, what would help actually you produce less lactic acid is as well as the Normatec compression boots, the 2 supplements that I like. I like the DMG, the dimethylglycine. I know that's what Mike was just talking about, right? Yeah. Long story short, that is a methylator, so it's going to help get oxygen to different metabolic processes in your body. I got roped into running the half marathon this year, and I did not train how I was supposed to. And I'm seriously giving a ton of credit to taking a lot of beetroot powder, just because that's a vasodilator for nitric oxide production, so you could get more blood flow to the area in the muscle. And then I was taking the DMG just because if you take that dimethylglycine, you're going to get oxygen quicker throughout your body, and indirectly you will produce less lactic acid in your legs. So I ran it with my little brother, and I only ran 5 times to train for the half marathon, which was, I don't recommend that. And the most I actually ran training was 5 miles. And so me and my little brother showed up for the race, and I was like, hey, bub, this isn't going to go well. And so we took it really nice and slow through like the first 5 miles, because everything after that was uncharted waters. And not to say this to sound, zealous or pompous, but I actually felt pretty good respiratory-wise, and my muscles actually felt really good too. The only thing that killed me was my joints, because I didn't actually train properly, so my body wasn't used to all the pounding on it. But I really, really attribute taking the beetroot powder and then the DMG just because my muscles felt great. It was basically because I fed my body everything it needed just to get through the race there. So did I ramble on long enough? Think I'm all good? Okay, guys. Well, yeah, thank you for sticking in for Wellness Week 109. If anybody has any questions, my lunch break is from 1 to 2. Call, and we could talk about if you would be a good patient for us. But realistically, yes, I'm a chiropractor, but there's some people I don't even adjust. We do a ton of soft tissue. And then again, one of my favorite things is I love seeing you in the clinic, but I love giving different corrective exercises and stretches. Let's be honest, there's only so much you could do in a half an hour in the treatment room, but we like to give you a lot of things that you could do at home just to prevent any kind of flare of any kind of symptom. So thanks for sticking in. If anybody has any questions about the modalities we offer, give us a call. The girls at the front will give a name and number, and I can answer any questions that you have. And yeah, I guess we'll see you guys at the next Wellness Week.